Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Organ donation. Introduction. There are two types of organ donation. The first one is when the donor is still alive, and the other type happens when a patient is no longer alive. People may donate a kidney, part of a liver, or bone marrow while they are still alive. These donations are usually arranged to benefit a specific person. For example, a brother may donate a kidney to a sister. A mother may donate part of her liver to a son or a daughter. The other type of organ donation is performed when a patient is no longer alive. This type of organ donation is the subject of this tutorial. Becoming an organ donor means you agree to let doctors use your tissues and organs when you are no longer alive to help patients who need them. Transplantation is the process of matching a donor with a recipient and performing the necessary surgery. There are more than 82,000 people waiting for organ transplantation in the United States. Each day, about 80 people receive transplantations, but another 20 die because of a shortage in donated organs. This tutorial explains what organ donation and transplantation are. It may help answer questions you have about organ donation as you consider your options. Organ donation. Becoming an organ donor means that you agree to give away one or more of your organs or tissues to help patients who need them when you are no longer alive. Agreeing to be an organ donor is a form of advance directives. Almost anyone at any age can become future organ donors. If you are 18 years or older, you can become an organ donor by signing a donor card or telling your family members or healthcare agent. This decision is usually noted on your driver's license. The following is a list of organs and tissues that can be donated and transplanted: bone, bone marrow, corneas, heart, intestines, kidney, liver, lung, pancreas, skin. Some body organs, such as bones, can be taken after the heart and lungs have stopped. Other organs can be given if the heart and lungs are still functioning. In these cases, these organs are taken only after the doctors have declared the patient to be brain dead. A person is considered brain dead when there is no brain function whatsoever, and there is no chance of recovering any brain function. It is only after a patient is declared to be brain dead that the organs are donated. Sometimes a patient on the respirator is not brain dead but will not recover. Some organs can be donated as soon as the heart stops. If the respirator is removed, the patient's heart may stop. The organs are donated as soon as the patient's heart stops after the respirator is removed. If you would like to become an organ donor, make sure to tell the Department of Motor Vehicles so they can add it to your driver's license or picture ID. Tell your family and loved ones that you want to be a donor as well. If you have prepared an advance health directives document, specify in it that you agree to donate your organs and tissues after you die. While a signed donor card and a driver's license with an organ donor designation are legal documents, organ and tissue donation is always discussed with family members prior to the donation. To ensure that your family understands your wishes, it is important that you share your decision to be an organ donor with them. Facts. You should know the following 5 facts as you decide whether or not to become an organ donor. 1. Organ donation is free. The donor's family does not pay or get paid for organ and tissue donation. 2. Organ donation does not change your medical treatment in any way. A transplant team does not become involved with the patient until all possible efforts to save the patient's life have failed. 3. Organ donation does not disfigure your body. Organs are removed surgically in a routine operation. It does not interfere with having a funeral, including open casket services. 4. The identity of the recipients is kept anonymous. However, if both the family of the organ donor and the recipient want it, they can be put in contact. 5. Experience has shown that family members of organ donors feel that the death of their loved one has not been in vain and something great has come from a very sad situation.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Transplantation. The United Network for Organ Sharing, UNOS, maintains the National Organ Procurement and Transplantation Network. Through the UNOS Organ Center, organ donations are matched to people who need them 24 hours a day, 365 days a year. The following section briefly describes the process of transplantation. 1. If you need an organ transplant, your healthcare provider will help you get on the national waiting list. 2. To get on the waiting list, you need to visit a transplant hospital. 3. A doctor will consider your situation and decide if you meet the requirements to be put on the list. You can also get on the waiting list at more than one transplant hospital. Each hospital has its own criteria for listing patients. If you meet their requirements, they will add you to the list. 4. You wait. There is no way to know how long you will wait to receive a donor organ. 5. Your name will be added to a pool of names. When an organ donor becomes available, all the patients in the pool are compared to that donor. Factors such as blood type, tissue type, size of the organ, medical urgency of the patient's illness, time already spent on the waiting list, and distance between donor and recipient are considered. The organ is offered first to the candidate who is the best match. The organs are distributed locally first, and if no match is found, they are offered regionally and then nationally until a recipient is found.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. In recent years, the science of organ transplantation has gotten better. Unfortunately, there are not enough organ donations for everyone who is in need. Organ donors are needed to save thousands of lives every year. Agreeing to donate organs does not affect the quality of care a person receives. Transplantation processes start only after the donor is no longer living. The decision to donate organs is yours. If you decide to become an organ donor, put it in your advance health directives and make sure your family and healthcare agent know about your decision.
Thank you for using Explain.